Hi, I'm Katie Couric. Welcome to Eye to Eye. According to a new CDC study, 1 out of every 20 adults suffers from arthritis so debilitating it limits their ability to work. CBS News spoke to one doctor who's using a new kind of treatment to help patients deal with their arthritis pain.
There's really no other device that does this. And that's the thing about deep wave. They've approached it from to this point, a pretty novel approach, where everyone else has tried to figure out a new way to do another surgical procedure or some sort of hocus pocus that they can give you a drink made from some berry from the Yucatan rainforest. I mean, this is a way to actually provide something that is non-invasive, that blocks the pain. We all know that arthritis at this point cannot be well treated. It's not treated well with surgery, and it's really masked more with medication. You're not curing arthritis with any of the medications. What you're trying to do is to control the pain and the inflammatory response. So maybe if we just say, hey, you know what, we can't cure your arthritis, but if we can block your pain, how happy would you be? Really, there are no other devices out there that work the way that deep wave works. One of the questions that everybody says is, isn't this just a modified TENS unit? And it's really not a TENS unit, because no matter how high you crank up a TENS unit, the most you're ever going to feel is a little tingle. But with the BioWave unit at about 20%, you'll feel it actually capturing the muscle, and it can make your arm move or contract, or whichever muscle group you're using on, move and contract, that TENS would never do for you. What he uses is an electrical waveform that blocks the pain signal. And the pain signal is just an electrical signal sent along the wires of the body, which are the nerves that go to the brain. If you can use an electrical signal to jam that pain, then the brain never senses the pain in the first place. And so a great deal of pain is perception. So if you can block or jam that wave going to the brain, you can trick the body into not feeling the pain nearly as much. If a person has total body pain, this certainly isn't for you. If a person has a discrete problem where your elbow hurts, your knee hurts, your low back hurts, if you can localize it to a certain area, this is something that can very well be a reasonable modality for you. The studies show it lasts about 24 to 48 hours. What we do is we basically give a trial in the office of 6 30-minute treatments. If you have a good response to that, then you get a home system that you can do for yourself every day or every other day on an as-necessary basis. The need is huge. There's so many people that have pain that you cannot control. And if your only option is to put someone on narcotics and have to accept the addiction that goes along with it, now what I tell my patients is you're trading 2 problems for one. Now you have back pain and an addiction. Before you just had back pain and you're probably better off.